Morning. Today we're going to look into um in this lecture we're going to look into LO3 of partnership. LO3. We've had LO2 and LO1 last week. And today's LO3 are going to look into how you understand to evaluate partnership. LO3. Very, very important. LO3. Understand how to evaluate partnership working. 301, we're going to look into how to explain the contribution learners can make to enhance partnership working. 2, evaluate own strength and weakness in relation to partnership working. 3, describe ways to improve own practice in relation to partnership working. 4, explain how to review the effectiveness of partnership working in achieving the agreed outcomes working together. So these are the things that we are going to look into. So eventually we're going to look into the roles and responsibilities, conflict that may arise and how to evaluate those conflicts and how to sort of put out some developmental plan in addressing those conflicts, right? All right, thank you. Let's crack on. We Okay, partnership in health and social care. Understand how to evaluate partnership working. Understand how to evaluate partnership working. Okay, so obviously we are going to look into some key principles in partnership evaluation. I mean, there should be mutual goals. There should be roles and responsibilities. There should be communication. There should be trust and respect. And there should be decision making. Okay, very important. In evaluation methods, we give feedback and surveys. We have to look into KPIs and outcomes. Look at agreed performance indicators. We have to ask those are case reviews or audits. Examine actual examples of joint working. So we all. And then last, we have to look at meetings and reflection. Regular partnership reviews minutes that can, enhance. Very important. Indicators of effective partnership working. It should be services should be more accessible and joined up. Reduce duplication of work or effort. Barriers to effective partnership, conflicting priorities or policies, power imbalance or unclear leadership, poor communication or silent work, lack of trust or commitment, resource or funding constraints. If I have to look into improvement strategies, clear memorandum of understanding or service level agreements, joint training and team building, conflict resolution process, leadership commitment and strategic alignment, continuous monitoring and open dialogue. We have to have example scenario, health and social care, and a hospital setting, social workers, nurses, and all these are things that we need to look into. Okay, so what then will be the contribution of learners, or what learners can do to sort of make enhanced partnership working? Okay, what may be the contribution of learners that would enhance partnership working? Okay, learners, whether on placement or training or newly qualified, they play an important role in strengthening partnership working within the health and social care. Their approach, behavior, and communication can directly impact how effectively services operate across teams and organizations. Understanding the roles and responsibilities. Learners must keep an open mind and show respect for the roles of others in the partnership. Every professional in a multi-agency team, whether a nurse, social worker, a therapist, or carer, brings different perspective and expertise. Learners should take time to understand these contributions instead of making assumptions or undervaluing certain roles. Recognizing the boundaries and expectation of each role helps avoid duplication, confusion, or tension in shared work. Collaboration and open communication. Okay, collaboration and open communication. Effective collaboration depends on clear communication channels. Learners should contribute by sharing relevant information, asking questions when unsure, and avoiding withholding concerns. This includes liaising directly with key individuals in the partnership, such as mentors, supervisors, or care coordinators. Speaking up when there is a risk to service quality or safety is not just helpful, it is necessary. Being non-judgmental is equally critical. Learners must avoid personal biases and base their interactions on facts and professional standards. They are expected to communicate openly, but respectfully with others, and even during disagreements. Also, learners do play major roles, and one of those roles is the open mind and a show of respect for their roles. I mean, you can have a role, but to respect the role or cherish the role is another thing. And so learners, by respecting the roles in their multi-agency teams or in their various teams, do help in enhancing, it sort of meets expectations that are set within the group or the goals that the group would want to make. Okay. And then also collaboration and open communication. Okay. There should be effective collaboration depends on clear communication channels. Learners should contribute by sharing relevant information, asking questions when unsure, and avoiding withholding concerns. This includes liaising directly with key individuals in the partnership, such as mentors, supervisors, or care coordinators. Speaking up when there's a risk to service quality or safety is not just helpful, it is necessary. Okay? It is very necessary to speak up to any issues that may have some risk involvement. And they also have to do things not being judgmental, okay, but should be very constructive and critical, okay? All right. Accountability and setting objectives, of course, very important. Accountability means taking ownership of actions, following through assigned tasks, are very important things when it comes to the partnership or what learners do contribute in their partnership. Very important. Okay. Yeah. So like I say, meeting objectives and setting by supervisors. Okay. Learners are to contribute to partnership by being reliable, organized, and willing to learn. They help build trust in the team when they follow through with care plans, attend team briefings, and meet deadlines for reports or assessments. Very, very important. Assertiveness, negotiation, and confidence. Assertive negotiation and confidence. While learners show respect, they must also develop assertiveness. Speaking up when something isn't right, asking for clarification, or highlighting concerns, not being aggressive or passive. They may be required to negotiate solutions, especially in complex cases with multiple agencies involved. For example, negotiating a care package with both health and social care services. Confidence grows with knowledge and experience. Confidence grows with knowledge and experience. But learners should show they are willing to participate actively, not just observe. By contributing suggestions and asking questions, they help move discussions forward and support effective discussions. This, I think, is very important because um, learners should be very assertive in that they should be able to question the question, you know, policies and question anything that they feel has some concerns, but they need to do that not being aggressive, but they need to be very passive. They may be required to negotiate solutions, especially in complex cases. Okay. So this is very important. In negotiation, you have to be a bit assertive. Confidence grows with knowledge and experience. But learners should show they are willing to participate. Okay. Willingness to participate is very key in enhancing partnership. Okay. There should be a sense of belonging. Right. Right. Thank you. The Care Act 2014. The Care Act 2014 enforces the need for joined-up person-centered care. It requires professionals, including learners, to work in partnership to meet the needs of individuals, especially those with complex care assistance. Learners should support this legal duty by engaging fully in integrated care planning and sharing relevant information across services. For example, If a learner notices a gap in someone's care plan during a multidisciplinary meeting, raising that concern helps fulfill the ad goal of promoting well-being and preventing needs for escalating. Very, very important. Very, very, very important. Very, very, very important. So a learner notices a gap in someone's care plan. Raising that concern helps fulfill the ad goal of promoting well-being. Effective teamwork. Ultimately, learners enhance partnership working by actively participating in team activities, from case discussions to handovers. They should ask for feedbacks, adapt their behavior when needed, and contribute to a passive professional environment. Good teamwork involves trust, shared purpose, and mutual support. Qualities learners help develop when they engage constructively, communicate clearly, and show genuine willingness to work with others. Very, very important. Evaluating my own contribution to partnership working means looking honestly at what I do well and where I need to improve. This includes how I handle conflict, solve problems, communicate with others, and respond to feedback. Conflict resolution and problem solving. One of my strengths is my ability to stay calm and look at issues objectively when conflict arises. It's very important that in conflict handling or management, learners and one of the quality that you need to observe things in a calm way. You don't address those issues aggressively. In fact, it is out of your calmness that you are able to assess the situation positively and give a constructive feedback. If you deal with the situation in an aggressive way, you will not sort of achieve a positive outcome. Okay, you have to separate your personal feelings from the facts, which helps when dealing with disagreements between team members. I use problem-solving techniques like identifying the root cause, suggesting options, and finding a solution everyone can agree on. You should also be comfortable with bargaining and compromise, especially when resources are limited or when team members have different views on how to support a service user. I've learned that cooperative conflict, where both sides are listened to, can lead to better solutions. It allows everyone to bring ideas to the table and feel included in decisions. However, one weakness is that I sometimes avoid addressing issues differently, especially when I'm new to a team or working with more senior professionals. This can delay resolution or allow problems to grow. I am working on being more assertive in these situations. Challenging discrimination and reporting concerns. Very important. Well, you become like a whistleblower. You have to see yourself my response to challenge discriminatory behavior, whether it's based on race, gender, disability, or anything else. One of my strengths is recognizing when a comment or action is appropriate. I know how to report concerns through the correct procedures and understand the importance of safeguarding the dignity and rights of service users. Still, I could improve my confidence in situations where discrimination is subtle or indirect. I sometimes hesitate if I think others might not agree with me. So I'm learning to trust instance more and follow through with proper reporting. Evaluating performance and using feedback. Appraisal systems and formal supervision meetings have helped me understand my role better. I use these opportunities to reflect on my practice, identify what I have done well, and set goals for improvement. My supervisors have often noted my reliability, my respectful attitude towards others, and my willingness to learn. I have always received feedback from families and service users, which helps me how my communication and support may make a difference. Positive comments give confidence, while suggestions for improvement guide me in adjusting how to work. So appraisal systems and formal supervision meetings have helped. It's very important that in joint feedback, appraisals help to keep you on track because you might be doing things right. However, you may have probably a more strategic way or more defining way of dealing with situations or goals. And therefore, appraisals will sort of give you a check and balances in that you remain within what is expected by organization or supervisor to do things in a more structured way. Okay. And feedbacks from families and service users are very important because it's the family and service users. The families are maybe the next of kin to the service user, and they probably might know the service user better than you, the carer or the social worker or the nurse per your assessment. And therefore, feedbacks from them would help because there may be some information that they may know from the service user that you may not, and that may sort of help you in how to communicate effectively with the candidates. Monitoring by external regulators. Of course, we have CQC, which is the Quality Care Commission that regulates organizations within the healthcare sector who assess how well partnership working contributes to safe, effective, and person-centered care. Knowing that our work is externally reviewed encourages me to meet professional standards, follow policies, and support the partnership in meeting its obligations. I regularly check that I'm meeting the required documentation, meeting with confidentiality and safeguarding protocols. These are areas that are closely monitored. External security motivates me to maintain high standards, but I'm still learning how to fully interpret inspection reports and indicate. Inspection reports may always have, normally by CQC, may always have a report that has a clear defined inspection audit on organization or a care home or a supported living facility. And in this, they look at how well you are organized in terms of your paperwork, your documentation, your data breaches, if you are doing GDPR policies very well, and if you have confidentiality, if you are having your safeguarding policies intact and all that. And when they have assessed you and they think they are okay, then they can give you a rating, whether underperformance, whether excellent performance, whether average or outstanding. And these are things that you need to learn or you should be able to know, because you should be able to have a report and see what were the shortcomings or the pitfalls in the organization so you can work on as a carer. Okay. Improving my own practice in partnership working means actively identifying areas where I can grow, developing my understanding of effective collaboration, and applying structured approach. One of my most practical ways one of my one of my one of the most practical ways to do this is through a personal development plan that focuses on the skills, knowledge, and behaviors needed for successful partnership working. Improving my own practice in partnership working means actively identifying areas where I can grow, developing my understanding of effective collaboration, and applying structured approaches. Developing my understanding of effective collaboration and applying structured approaches. One of the most practical ways to do this through a personal development plan that focuses on skills, knowledge, and behavior needed for successful planning working. Okay. Mm. Development plan goals. To improve, I would include the following key objectives in my development plan. Establishing and maintaining partnership working. Attend induction or shadowing opportunities with other professionals, e.g. nurses, social workers, care coordinators to learn how they contribute to shared goals. Join team meetings and multi-agency case discussion more actively to build confidence and strengthening working relationships. Key communication professional, respectful and to build trust and reliability with team members. Development approaches to partnership working. Learn more about different approaches to partnership, such as multidisciplinary, interagency, and collaborative models and how they are used in practice. Reflect regularly on outcomes of joint working. What worked, what didn't, and all that. Improving understanding or partnership working. You have to study relevant policies or frameworks like the Care-Act 2014, which sets out the legal duty for integrated care and share responsibilities. Okay. Seek feedback from mentors, service users, or peer about how I work within teams and use it to improve. Use CPD, continuous professional development opportunities such as workshops online. The benefits of improved practice. Okay, we have to look into that. We also have to look at the practical steps for improvement. Get smart targets. For example, by the end of next month, I will attend at least 2 multi-agency meetings and contribute actively. Smart where we say specific, measurable, accountability, realistic, and time-bound. Okay, very important. You have to keep a reflective journal. Record examples of partnership work. Nothing went well and what could be improved. Request supervision. Focus on partnership. Use one-on-one supervision to discuss team dynamics, difficult interactions, or conflicts. Use case studies on scenarios. Practice responding to real-life examples of partnership challenges and reflect on possible actions or solutions. Benefits of improved practice. By following a development plan focused on partnership working, I will improve not just my individual performance, oh yes, but then the outcomes for service users, better communication, understanding and collaboration lead to more effective person-centered care. It also builds my confidence and makes me more valuable member of my team. Very important. You ought to contribute something to make you valuable. What makes you valuable is contribution. Well, what makes people see you valuable is your contribution to your society and your ability to add to suggestions or ability to sort of bring change wherever you find yourself. Okay, right? You have to review effective partnership working achievements. Very, very important. Reviewing own contributions and leadership style. We have to assess the effectiveness of partnership working. I need to start by reflecting on my contribution. This includes how well I communicate and share information, whether I complete tasks on time or followed procedures. If I support colleagues and to feedback, I also look at my leadership style, especially in situations where I've had to take initiative, coordinate support, or lead part of all inclusive, assertive, or fair. Do I need to have more structured and confident when getting orders? So, in looking at your leadership style or your style of leadership, you have to look at how well you communicate, you know, how you complete tasks, whether on time or how you follow procedures. Are you assertive and fair, or are you assertive and rude? Very important. Very, very important. So reflective on a regular review situation where partnership working went well or not. Ask myself, what is my role? Did I help more things forward? Could I have acted sooner or differently? This kind of self-assessment is key to improve both individual and team performance. Very important. So we can also look into the impact on service users when there are effective partnership. What may be the impact of service users? Very, very, very important. What may be the impact? Okay. What may be the impact? So measuring the impact. The main measure of partnership effectiveness is the impact on the recipient of care. Reviews should look at, has the person condition improved? Are they more independent, safer, or better supported? Are they satisfied with the service they received? Gathering feedback from the service user and their family is important. It tells if our joint work is actually making a difference in real life, not just on paper. Reviewing the care plan. Another important way to review effectiveness is by examining the care plan. Were the goals of the plan met? Did each partner carry out their role as agreed? Are there any gaps, delays, or duplications in service? Care plans should be regularly updated based on outcomes, feedback, and any changes in individuals' needs. Review the plan shows if the partnership is flexible, responsive, and focused on the person's well-being. If issues are found during the review, such as poor communication, unclear responsibilities, or missed appointments, these should be addressed in follow-up meetings or supervision. It is not just about pointing out what went wrong. It's about learning from it and making the partnership stronger and going forward. Very important. In summary, we will say that reviewing and effectiveness of partnership working involves reflect on your own role and leadership, monitoring service delivery and user outcomes, evaluating the progress and result of the care plan. This ensures that partnerships are not working, but working well in the best interest of those we support. Very important. One of the reference we can look is the Care-Act 2014. Department of Health and Social Care working in partnership to deliver better health care. And we have the Social Care Initiative for Excellence, and we have the Skills for Care. Skills for Care. Skills for Care. Very important. Skills for Care. Skills for Care. Very important. Okay. If you go to your student model, you could see all the journals and ebooks that you can read. If you have any questions at all, you can email us at thelearnerwork@ukvarsity.co.uk, and we should be able to attend to you. If you have any submission, that will be 2 weeks from the last lecture, that will be tomorrow. We expect that you start putting your assignments. Okay. Right. Thank you. All the best. See you. Bye-bye.